costs are projected to skyrocket for millions of Americans. Republicans, well, they could have avoided the situation by working with Democrats during the government shutdown. But as Congress returns today, the GOP, they still have no solution. And the president, he is sending mixed signals at best. Last week, Trump was expected to unveil an alternative plan that would have extended Obamacare subsidies for another 2 years. But the White House walked that back after some Republicans cried foul. So now the clock is ticking and time is running out. Joining us now, Democratic Congresswoman Sarah McBride of Delaware.
Welcome, Congresswoman. My Republican friends cried foul because the politics is not in the plan. The politics is in talking about the plan. The politics is using this issue as a wedge. I remember sitting in meetings back in 2010 on this subject as we were debating the origin story of Obamacare and having conversations about what does the market look like. And unfortunately, Republicans have gotten trapped in a market-based thinking about health care and avoiding the reality, as you know well, from your own campaigns out there, that people have a different outcome when health care is available to them. And we can debate from either side what that ultimately looks like for both the market and the patient or the consumer. But we're not in that space now. So how do you see us getting beyond that? Because, yes, the Democrats cut a deal for a vote on the subsidies, on the Obamacare subsidies. We know how that vote's going to go in the United States Senate. So help me get through the next point of this. Is this something that's going to get kicked further down the line and those premiums are going to hit in a way that lands on both parties? Or will Democrats be able to make the case appropriately about where the trouble in this equation lies?
Well, as you alluded to, Michael, we've been waiting for even concepts of a plan since 2010. And every step of the way, Republicans in Congress have tried to sabotage the Affordable Care Act to make health care more unaffordable and more inaccessible for people. I've been here 11 months in Congress, and I can tell you that the only thing that congressional Republicans are more loyal to than Donald Trump is to cutting the health care of the American people. They do not want to solve this problem. They do not want to solve the fact that right now we are a month in to open enrollment under the Affordable Care Act. And my constituents and constituents of colleagues around the country are seeing their healthcare premiums spike 100, 200, 300%. We may get a vote in the Senate, but it's clear that House Republicans are hell-bent on preventing any kind of vote on reducing premiums and extending the Affordable Care Act tax credits. House Democrats are committed to using any lever at our disposal, including the discharge petition, to try to force a vote on extending the ACA tax credits. But as I mentioned, Republicans in the House, led by Mike Johnson, have nixed any opportunity for a good faith negotiation. The president wanted to come to the negotiating table, but Mike Johnson killed that. And I think it demonstrates that Donald Trump is weak and House Republicans are cruel.
So what do people do, Congresswoman? As you noted, right now, open enrollment is happening. Let's just say people out here have insurance that's funded by their employer. Looking at even signing up for that insurance, the numbers are staggering and they are stark. It is not hyperbole to say that people are going to be unable to afford insurance next year. There are going to be folks that make the decision to drop their coverage. The rural hospitals are going to be affected by this. People could die. What do people do?
People will die if we do not extend the Affordable Care Act tax credits, if we continue to let the historic Medicaid cuts that are on the horizon go into effect. The consequences are going to be vast, dangerous, and deadly for people. I'm certainly going to continue to fight to prevent the Medicaid cuts, to extend the ACA tax credits, but we have to level with the American people, which is that so long as Republicans control both chambers of Congress, so long as Donald Trump is president, we are unlikely to see meaningful action in lowering the cost of healthcare and making affordable and accessible healthcare a reality for every single American. I think if we get the House in the next November's election, we have a fighting chance to extend the ACA tax credits then. We're going to continue to try to push with the discharge petition, but people have to understand that it's going to be a challenge, and people are not only going to see their healthcare premiums increase if these ACA tax credits are not extended before January 1st, but to your point, people will die. An independent, nonpartisan study found that there will be 50,000 deaths a year, preventable deaths a year, because of the big ugly bill and because of the expiration of the ACA tax credits. Donald Trump likes to own things and slap his name on them. Well, because of his action and inaction and congressional Republicans' inaction and actions in cutting healthcare, they now own the American healthcare system. They will own it today, tomorrow, next year, next November, and they will own it until they actually come to the table and try to work with us in good faith to solve this crisis, but I'm not going to hold my breath.
So as though the ACA subsidy crisis were not enough, while you and I were enjoying our Thanksgiving dinner, there was new reporting from NBC News that the Trump administration is now saying, get ready for this, that nursing is not a professional degree, and they're going to put new limits on loans. Okay. So at a time when student loan is skyrocketing, a time when we need more nurses in this noble profession, how is this supposed to help reduce the cost of healthcare in the United States?
It won't, and it's incredibly disrespectful to nurses. I was the caregiver to my husband, Andy, during his battle with terminal cancer, and I, like anyone who has ever engaged in the American healthcare system, know that nurses are the central nervous system of our healthcare system. They make everything work, and they make quality care a reality for so many people across this country. And this action by the Trump administration is not only disrespectful to nurses, it's also going to result in more nurses having more debt. It's going to result in fewer people going into the nursing profession and getting the advanced degrees necessary to be nurse practitioners, to be nurse midwives. And that's only going to exacerbate the existing nursing shortage that we have across this country and make healthcare that much more challenging for people to get, especially in rural communities.
I think it's very interesting that you have Speaker Jeffries out there saying, listen, all we need is a handful of Republicans come on board. We can extend this for 3 more years. It's actually not that hard.
And the thing about it is, I remember Congresswoman doing the debates on health care in 2010, making the point in one meeting that we have 14 doctors, Republican doctors in the House at that time, and couldn't come up with a response, even though we had to acknowledge, and some refused to, that Obamacare was basically the Heritage Plan. It was the Mitt Romney plan. So it's not like Republicans don't have ideas about how to construct a health care plan in our current system. Do you think there are other drivers in every administration, including Biden and Obama, in the room have not been patients and nurses and doctors and caregivers like yourself, but pharmaceutical companies and insurance companies driving that conversation? We're not going to get health care fixed in this country until you get the people who have to use the system in the room to help decide how best to make use of that system. You got about 30 seconds, if you could, if you have a response.
That's exactly right. We have to take on pharmaceutical companies who are driving up the cost of prescription drugs. We have to take on the consolidation of healthcare into hospitals, which are really shirking primary care and getting their money from specialty care. We have to take on the insurance industry that is denying care in order to make profits. We have to take on a system that is prioritizing profits over people, and that only comes by having people at the decision-making desks, at the conference table, negotiating a plan forward so that this is a system that truly works for people and is a healthcare system, not the sickness system that we have right now.
Michael, I must say, justice for the nurses out there. My mother-in-law was a nurse for 30-plus years. It is insane what this administration is doing.
I couldn't agree more. Congresswoman Sarah McBride of Delaware, thank you very much for your time.